Welcome to Mum Abroad's YouTube channel. I'm joined today by Janette Bremner, a registered nurse for over 30 years in the UK. She has a degree in community health, is a registered health visitor and specialist community public health nurse, and has a postgraduate diploma in law. She's a specialist in child health, is trained in child safeguarding, domestic abuse, breastfeeding, and child sleep management. In 2021, Janette moved to Malaga in the south of Spain with her partner and founded Maat Family, offering support and advice for parents-to-be and families with young children. She has 2 grown-up children herself. Hi, Janette.
Hi, Jane. Lovely to be here.
Thank you for joining me. Janette, what would you say is the biggest challenge for families with young children who have moved away from their home country?
It's a really good question. I think the biggest thing that they would all say, almost without exception, is that they just miss the familiar stuff and the familiar people. So, it's a very vulnerable time being pregnant and having a baby. And it's just when most people, if they've had a supportive family, it's when they drift back to that family and they value the parenting that they had. And it's just being without their friends and family. And being in Spain, things are not terribly different, but they're different enough that can be enough. If someone's feeling a little bit fragile, it could be enough to make them feel very alone. And I think that is the biggest thing, just not having the familiar things. And even for people who've lived in Spain for a long time, if they don't have their family around them, it makes it very lonely.
What was the inspiration behind Maat Family, and is the name significant?
Yes, so in terms of the company, the inspiration there was I've been a health visitor for a long time, as you kindly said in your introduction. And I was thinking I didn't want to just do nothing. I didn't want to retire early to Spain and do nothing. I wanted to do something. And I thought, well, what am I good at and what do I love? And it's the job I've been doing for years. And I wanted to carry on doing it. And what's lovely for me now is that I can do it to a really high standard. Of course, I was a great health visitor. I was good health visitor in the UK, but I was very restricted in what I could offer, and I had to say no sometimes when people needed things. Now I can offer a really bespoke service. So the inspiration of Maat Family really was to be able to offer a good service to people who don't have that here in Spain. The name Maat Family, Maat was an ancient goddess, and she was the goddess of calm after chaos. So that inspired me. And this goddess used to carry a feather, an ostrich feather, which it just feels calm and restful and peaceful. And she used to, after any episode of chaos or destruction, she used to bring calm and peace. So I thought that was a really nice name because it kind of sums up a lot of the aspects of the work I do.
I love that name, really, really nice.
Thank you.
What advice would you give to women who are pregnant for the first time when they're in Spain?
Okay, so anybody who's pregnant at all, wherever they are, I always say read enough to feel informed, but not so much to be worried. And only a woman will know how anxiety provoking she finds some information. So that's the first thing, would be to just be informed enough and talk to family and friends, but get good advice from reputable sources. One of those sources, of course, is obstetrician or gynecologist. And I think it's really important in Spain to find an obstetrician that you feel that you, as a woman who's going to be having a baby, my clients, I would really advise them to find an obstetrician that they feel that they can click with well enough and feel they could work with well enough. The way to do that in Spain is very much, it really links back to whatever kind of health insurance they've got. So if someone's from an EU country and they can go to their family doctor and they're covered by their EU cover, then they can talk to their family doctor about the hospitals that are available to them, and they can actually go and meet different obstetricians. If they've got health insurance, private health insurance, then they need to approach their insurance company and talk about what is on offer for them. So which hospitals are local enough to them that offer a maternity service, what are the obstetricians that the insurance would permit them to see, and then they've got their shortlist and they can choose from there. And most obstetricians don't mind having some sort of conversation or speaking to their secretary about having a meeting to meet up and see whether it's going to be a collaboration that works. But it is really important to find somebody who they can work with, and also has good, the cesarean rate in Spain is very high, and that might be something that some women feel strongly about and want to have an obstetrician who's keen on keeping a cesarean rate low if it's appropriate for them. So there are all sorts of things to look at, and that's one of the things I can talk through with people if I see them antenatally.
And what other services would you offer in your antenatal package? What else does that encompass?
Okay, so my standard antenatal package, I would do 3 contracts, which I like to do at home. If people are local to me, I would do those as home visits now that COVID's restrictions are allowing that. And in my first visit, I would have a little bit of a get to know you session, meet partner or husband if he's still involved in the situation. Get to know people, do a little bit of a brief health history. Also, find out a little bit about people's emotional state, because if people have had a long history of depression or anxiety, I can then tailor my advice accordingly and be more helpful and respond appropriately to anything that might be worrying for the expectant parents. So that's the first visit. We just get to know each other. I outline what the other 2 visits are going to entail, and we plan accordingly and get things in the diary and so on. I also sometimes parents like me to look at the layout of their home. So I wouldn't insist ever on doing this, but some parents like me to look at where they're going to plan to have the baby sleeping, to check that it's a safe environment and any equipment they might need. So we do that in that visit as well if it's wanted. The second visit on my antenatal package is all about the labour, and that's pretty much what people are focused on. They can't get past the labour. So we talk through what is available in Spain, what the different type of labours are, all the different scenarios, normal vaginal birth, assisted deliveries, cesarean, what to expect in each of those scenarios, what your body's doing during labour, and the little bits that people don't tell you. So the stuff that your good friend would tell you if you really wanted to know. And we talk, and I have that as a very open discussion, not to create anxiety, but all of the research tells us that if women feel prepared and informed about what their body is doing during labour, it leads to a much less invasive procedure. It's much less medicalised. It goes much more naturally. They need less pain relief, and the outcome is often much more positive. The third visit is about lifting the focus away from labour and looking forward to having a baby. So it's preparing for a baby. So I go through any questions that people have, again, about equipment or about feeding, about health issues that crop up with a baby, common little ailments, things that happen that are really not anything worth worrying about. It's very difficult for women who is still in their pregnancy to focus. They know they're going to have a baby and they prepare the room and they buy the clothes, but they don't very often read up about caring for a baby, knowing the common things that can happen. And all of a sudden they've got a brand new baby, they're exhausted from a labour, and suddenly they find that they should be reading and they haven't been reading because all they've done is read about labour. So I encourage a change in focus there just for an hour while I'm visiting, and we talk through all of those common things that happen after a baby's here. We talk through feeding, what type of feeding somebody wants to do, and very, very important things that they can do in the early hours and days that will help, particularly if a mum's planning to breastfeed, things that can promote breastfeeding and make it much more successful and prevent mastitis, etc. Really early on, before I've even managed to do a postnatal visit. So there is quite a lot we can talk about and things that will happen with the baby, so that when it happens, they think, oh yeah, Janette told me about that. She said that might happen. I don't need to worry, but I'll get in touch with her anyway and check. So it's a good little package, and we do those 3 visits. And I found lots of women have really enjoyed that. They've gone into the labour process feeling much more informed and ready as they ever can be.
You mentioned earlier about how difficult it can be away from family, particularly if you're pregnant for the first time or you have a young baby. And from my own experience, I found it was essential to find other women in the same situation as me, whether that was being pregnant at the same time or having, a young baby at the same time. What would you say is the best way to meet other women in the same situation as you?
Well, I mean, I think there are a couple of ways. One way that some of the women I've worked with is that they've actually actually met in the waiting room of their antenatal clinic. So the first thing I would say to mums is you're going to have a baby, and you'll become much more sociable because of that. People will approach you because you've got a baby, but do it with pregnant mums as well. So if you see a pregnant mum and you're thinking, actually, I don't know anybody else who's pregnant, just going up to her and saying, I hope you don't mind, but my baby's due in, 2 months' time. When's your baby due? Are you local? Because I don't know anyone else who's pregnant. And you'll probably find they're in the same boat. So to open up, lift your eyes up, and be willing to talk, even if you're not normally that sort of person. It can be that little step that can make you develop a friend that could be a friend for life. And often the friends you make when you've got a baby are very special for that reason. The other is to try and find little groups. You're absolutely right. I'm still new to trying to work out what they do in Spain, and I don't think they have postnatal groups in the same way that we do in a lot of the rest of Europe and that we do in the UK. And that's something I'm going to try and add in at some point. Once I've got a little further into my journey with this business, I'm going to think about having a postnatal group, because I think it might be really valuable. What I'm doing at the moment is the ladies that I see who've got babies who are due around the same sort of time, I'm encouraging them to get together, and I'm offering group contact. So I will go, for example, do a first aid discussion or weaning discussion to 3 or 4 mums in one of their homes. I don't want to start hiring halls and having all of that. But if someone's got a home that they're willing to invite their guests round, some friends, go to their home, everyone can have a cup of tea, someone can take cake, and I can take my baby scales, and I can do what would be a little postnatal group and go through immunisations or weaning or whatever the mums want, and have a little plan for what we're going to go through. So, but I think looking for groups, and I think as well, you can go to parks and play areas, because of course don't forget that there are women with older children who will be having babies. So it's quite a good place to meet other mums with children of different ages.
I think also social media pages, groups and pages are really helpful at this point as well. I know when I had my children, it's a few years ago now, and we used to get together by using email groups. It was kind of old fashioned, but now if you go onto Facebook, you can quite often find groups in your area, I think, where people arrange to meet up that way.
I'm so glad you mentioned that, because I should have added that in. It can be really, really helpful. And people don't need to be going out to meet anybody. If they're feeling they're stuck at home, they're in the early weeks, they've got a baby who's feeding all the time. Sometimes it's so stressful just leaving the house. And to be able to get a little bit of support in a WhatsApp group or in a Facebook group, it can be just what people need in those early weeks before they're ready really to do too much that's ambitious. So yeah, I'm so glad you said that. Absolutely true.
So Janette, you've talked quite a bit about pregnancy and your antenatal services, and we talked about how important it is for women to find other women in the same situation as themselves when they're pregnant. What about after the baby's born? What kind of postnatal services do you offer?
Okay, so this really was the real gap in the market, which I think I've been able to meet quite well. babies who are born in Spain, mothers are sent home with their baby, and they're pretty much expected to get on with it. They have a couple of appointments with an obstetrician, and then they have the health service, obviously, for any medical issues. They have their family doctor they can go to, and they have a paediatrician. So in terms of health and paediatric cover and so on, they're covered very well here. What they don't get is somebody who's really wanting to sit for 10 or 15 minutes and talk about feeding, or about sleep, or about that funny spot on the baby's knee, or how do I clean a baby boy's genitalia? How do I clean their eyes, their mouth? What do I do? The baby's got dreadful nappy rash, but I don't think it's bad enough to see a doctor. There is just so much that a new parent has to deal with a new baby. And if they've not been in touch with babies before and don't know, it can be really overwhelming. So postnatally, I think, is where I can be really, really useful to people if they're struggling or if they're not struggling. I can offer advice about feeding. I've got baby scale, so I can weigh the baby and monitor the weight. Obviously, if there are health issues, I'm a registered nurse, but I'm not a registered nurse in Spain. I'm a UK registered nurse. So I'm always very aware that, if there are medical issues, I would be very sensible and say, I think you need to go back to your obstetrician or your paediatrician and talk this through with them. But if a baby's doing well, and it's just general questions and being unsure, then we can monitor the baby's weight. We can talk through feeding issues, sleep, routines, skin ailments, how to look after the baby's cord, the maternal recovery. So we can talk through, how the womb is, contracting back down, any stitches, any bleeding, the wound. I can look at all of that, and as long as it's going in the right direction, I can say that's looking great. Don't need to worry about it. If there's anything I am concerned about, again, I would highlight it. But all of that postnatal care that normally, women would sort of expect to have a little bit of follow-up and a little bit of time for questions, that's not something that's part of the health service in Spain, because the general presumption is that people will use their family to help look after them and so on. The other thing which I will mention is that I'm qualified to screen for postnatal depression as well. So I'm not a psychiatrist, I'm not a psychotherapist or psychologist, but I've worked with postnatal women enough, and I have training in postnatal depression screening. So if somebody was thinking that they're feeling a little bit low and not coping very well, or feeling overwhelmed, I can help tease out whether that is just exhaustion from a new baby, feeling tired, or whether it's anxiety, or whether it's early depression, or whether it's the baby blues that will go, or whether it is something that needs a bit of extra support. So that can be really valuable as well, because mothers will sometimes feel quite vulnerable and fragile and don't want to talk to their family because they think, I'm supposed to be happy with a new baby, but I feel awful. And I'm a third party. I'm not going to lie awake at night worrying whether they're depressed or not. I will deal with it, do what needs to be done, and help them. Obviously, I'd be worried for them, but they know they can talk to me, whereas they know their family would be very worried for them. So that's another thing that I can offer, and I can advise and signpost about what they need to do depending on how severe their symptoms are.
Yeah, that's really valuable, isn't it?
Yeah.
We mentioned before that you are based in Malaga, that's in the south of Spain. What happens if anybody's watching who's living in Barcelona or Madrid or in the north, for example, and they just like the sound of you and they want to chat to you? They like the idea of being able to speak to a British qualified nurse and practitioner. Would you offer consulting to people online, over the phone and so on, purely without having any home visits as well?
Absolutely. That's what COVID has taught us, hasn't it? It's taught us that we can offer and we can expect a good service with or without face-to-face contact. There's nothing quite like being in someone's living room and having a nice cool cup of iced tea out, in the sun, and seeing the baby asleep. And there's nothing replaces that, really. But I've done, video conferencing, WhatsApp calls, Zoom. I can organise in whatever format people like. Not a problem. Some people prefer phone calls because they don't feel quite so under the spotlight. Other people prefer to have a video conference. What I tend to like to do if someone's remote is like to have a phone call first so that they don't feel on the spot. They get the feel of me. We can talk a little bit about what they might be needing, and then set up a video or a WhatsApp video call or Zoom, to talk things through, particularly if they want to show me a baby's rash or a baby's eye that's looking a bit gunky or the tummy button that's not healed up properly. It can be quite useful then to have the camera. But yes, absolutely. Somebody who's not in Malaga province, but is at a distance and wants the support, it can still be done. Yeah.
So we've talked quite a lot about pregnancy and young babies, but you also work with families with toddlers and slightly older children. What kind of issues might families come to you with?
Okay, yeah. So I'm trained to work with children up until UK school age, which would be coming up to 5. So the sorts of things that people get stuck with, they get stuck in the rut, they lose their way, they want to be good parents, most of them do want to be good parents, but they've just lost how to do it. The sort of things that I can help with are sleep again, because babies that sleep well don't necessarily turn into toddlers who sleep well, who don't necessarily turn into children who sleep well. So sleep is a big one. Toddler tantrums, toilet training, teething, weaning. Obviously, weaning's a bit younger again. Starting school, sibling rivalry. So a new baby's coming along, and the older child is starting to, create chaos. Particularly if people are moving countries. People have moved from the UK to Spain. Grandparents aren't around. Mum's given up work or has had to start work. New house, hot at night. All of a sudden, children are, and they're mixing perhaps in Spanish nurseries with Spanish children who have got a completely different routine and timing of their day. So, the children are getting tired at the wrong time. So behaviour can just erupt into chaos. And I can help, bring that back under control again and talk through a little bit like Super Nanny, but I, have a slightly different approach. But it's that sort of thing, anything that's disrupting family life. And I don't want parents to think it's all about their child being naughty, don't like the word, but a child exhibiting bad behavior. It's a dynamic there, and almost certainly when our children are misbehaving, it's because we've changed a little bit the way we're doing stuff, and we're, without realizing it, we're giving them attention for stuff that they're doing that's creating a bit of, and they like the performance and they like the reaction. So parents need to be a little bit prepared for me to gently and as kindly as needs be, for me to be saying, well, we need to look at what the child's doing, but we also need to look at what you're doing as a parent, because the two react against each other. We all know that. A child falls over. If you say, oh, have you hurt yourself? They'll cry. If we say, up you get, come on, pop it. Oh, look at you. What should we do now? They're up and they're jumping and they're happy. So we know that our reaction can definitely affect the way children behave and the way they feel. And that all forms part of any work that I have with particularly the older children.
Janette, what would you say is the most rewarding aspect of your work?
Well, I think it's like with anything. The greatest thing is when parents say, thank you so much, Janette. I don't know one lady said to me once, and she was quite serious. She said, you helped me with my postnatal depression, and I don't think I'd be here today if it hadn't been for you. So, that was the biggest one ever. And it's just when people say thank you, when people say, I don't know how I would have done it. It's been, or sometimes I talk to people on the phone and they say, oh my goodness, what you advised has been amazing. He's a different baby. Now, of course, we all love our babies as they are, but when they turn into a nicer, different baby, a more manageable, happier baby, that's lovely. So the most rewarding thing about my job is that parents are actually finding that they can do it. They were the good parent they thought they wanted to be all along. They're there. It's just that they've lost lost sight of it a bit in what felt like, feeling pretty miserable.
Well, you're obviously very, very passionate about what you do, and you're very knowledgeable as well. It's been really, really lovely to talk to you. If anybody watching is interested to find out more, they can have a look at your website, which is there at the bottom of the screen. That's www.maatfamily.com. And there they'll find your contact details, so email address and phone number.
Yes.
So that just leaves me to say thank you very much for joining me today, Janette.
Thank you very much, Jen. It's been a real pleasure, and I'd love to get some clients from Mum Abroad and be of any help to anybody who needs it. And thank you very much indeed for giving me the opportunity to talk with you.